COVID-19 still has a few tricks in store, and it's clear that we need to hold on together a bit stronger and longer until vaccines have us better protected.
Federal health officials want Canadians to reduce their contacts and governments to increase or at least maintain restrictions. If these steps aren't taken, officials say we could see 12,000 new cases by the end of April. Sources tell CBC News Ontario government advisors have concerns about variants. Their analysis shows a 60% increased risk of hospitalization, a 100% increased risk of being admitted to the ICU, and a 60% increased risk of death. That is compared to the original strain of the virus. The Primetime panel is back to discuss it all. Laura Stone, Zane Velji, and our guest, Raywat Deonandan, epidemiologist and associate professor at the University of Ottawa. Raywat, I'm going to start with you. I mean, there is a sense that we just sort of keep having this same conversation over and over, it starts to feel like, but the case numbers are creeping up is, I guess, what changes. What's your take? Like, how would you summarize what's happening right now in this country vis-a-vis COVID?
You know, Dr. Michael Warner had the most pithy and disturbing tweet earlier. He said, the third wave was framed as a race between variants and vaccines. The variants have won, and now it's a race between vaccination and ICU capacity. So we're kind of where we were in March of last year, except it's worse because the variants are far more infectious than COVID classic, as I call it. And last year, we had more hospital capacity. We had full staffing of healthcare workers. We had canceled some elective surgeries and things like that. We haven't got that now. So there really is a dire threat to our healthcare system now. And I don't think people fully understand how bad it is. It's pretty bad.
Why do you think that is? That people don't
understand it? Because we have some fatigue. We've had a year of this now, and the world hasn't collapsed. Society is still running. We still have our jobs, most of us, and our loved ones and our day-to-day activities for the most part. So the existential crisis has not been digested. But this is the last great battle we have to fight here, the battle against the variants. And it's a rough one. This might be the worst of the three waves if we don't do all the right things. We have a window of opportunity here to slow transmission, to prevent the variants from really accelerating out of control, to give us time to vaccinate the most at risk so that the toll in the healthcare system is not as bad as it would have been otherwise.
I'd like to get you, Raywat, just to weigh in as well on what CBC has been reporting about what the Ontario Science Advisory Table is going to report next week about the variants of concern, increased likelihood of hospitalization, ICU, death. I don't know. What do you make of it? I mean, should we be alarmed? Should we have already been cognizant that it was potentially going to be this bad?
I think this should have been on everyone's radar to begin with. The variants are that bad, and the numbers we're seeing now don't really reflect the true reality on the ground because of lagging in reporting, anywhere from 48 hours to 2 weeks in lags, because that's how long it takes to sequence the genome and to get proper identification of variants. It is that bad. So what does that leave us in terms of policy options? Of course, vaccination, paid leave, we've been talking about for months, and nothing seems to happen around it. Workplace surveillance, especially asymptomatic surveillance, could be useful, and enforcing public health rules. So there's still things we can do that we're not doing to slow down this possible eventuality.
Laura, that's a perfect moment to bring you in and talk about what Ontario is and isn't doing, which is, on the one hand, we have areas that are going into lockdown, and then on the other hand, people are going to be able to get their haircut in some of these areas. Talk to me about how the Premier is framing how they're trying to deal with the situation as it stands right now.
Well, I mean, those two things are no longer mutually exclusive. You will now be able to get your haircut in a lockdown zone. And I think that's part of this story, that the goalposts keep shifting here. And there's clearly a resistance on the part of the province to impose tighter restrictions, and there's a loosening of them. Some of those restrictions are outdoor, allowing more activities to take place outdoors, which many epidemiologists do agree with. And obviously, the goal here is to drive people outside safely as opposed to gathering indoors. But we've seen in the past couple of weeks Ontario loosening indoor dining rules in many regions. And then with the announcement today that haircuts, nail salons, and tattoo parlors will be able to open at a reduced capacity in mid-April. So on the one hand, the Premier is saying he is very concerned. Tattoo parlors.
I had missed that
one.
Get
I think they call it body art establishments, but we all know what that means. So on the one hand, you do have the premier, expressing concern, but then, not really taking that action that I think some of the, obviously in the hospital sector would like to see. And he did admit today that people are very tired and they want to loosen things up a little bit to give people that sense of freedom. So, it sort of remains to be seen, how this will play out. And it is that race against time with vaccinations and the variants. And Ontario is obviously gambling here with trying to allow a little more freedom as we await that mass vaccination effort.
Zane, in Alberta, Dr. Hinshaw has warned that more restrictions might be needed to slow the spread of the variants. Do you think governments are even more reluctant now than they were, say, 6 months ago to add new restrictions? Or do you think the threat, I'll say, posed by the variants curtails that reluctance?
I think they're reluctant to move on to new phases and are founding, political escape hatches to do so, and frankly, often public health evidence to not do so. I think, there is some merit as related to the fact that they're not necessarily bringing in restrictions because they don't want to quell the optimism. They don't want to quell the upside that we feel. But I think at the end of the day, this is where we've seen a communications failure, whether that be here in Alberta or elsewhere across the country. At some point, I don't know why and I don't know how, we almost made this less about people and really humanizing it and really kind of made it an academic exercise of number chasing. And I think part of it relates to the doctor's point regarding most of us, if you're in the top 10% of this country, you're living your best life right now. You've saved more than ever before. Things have gone well with you. But if you're not in that category, we know this virus has ultimately discriminated. And those faces and that humanistic aspect of who we are impacting by not following these restrictions and not being judicious with how we approach our lives has been lost somewhere to a data crunching exercise. And so I think that's been the communications miss. I think there's still time to bring that in, perhaps diversifying message and messenger a bit. But I think that's part of the trick that I think all provinces need to bring into the fold if we want to actually win with 2 minutes left in the fourth quarter, so to speak.
Raywat Deonandan, I want to ask you about something that I've been hearing. I was struck by the fact that this refrain seems to be repeating itself one province to the next. Quebec Premier François Legault today was asked why he isn't imposing stronger restrictions in the face of these variants. So let's listen to what he had to say, and then I want you to react.
We want the population to follow the measures we put in place. We have to find a balance. If we're too strong, too hard, we may lose everybody. So we're trying to balance.
I talked to Premier Higgs earlier today. He talked about fatigue. We've heard it from Doug Ford. I mean, we're hearing it right across the country. What do you make when you hear our premiers, our political leaders saying that?
Well, what are we trying to balance here? Are we trying to balance the ability of these restrictions to do their job versus the tolerance of people to follow their restrictions? Or are we trying to balance the economic impact of restrictions? If it's the latter, then a lot of the evidence points to the fact that the economic impacts are lessened if you restrict hard and quickly and shorten the suffering. On the other hand, there is something to be said for trying to grab onto Jell-O. If you tighten too hard, the Jell-O squeezes out between your fingers. But I think the situation is so dire right now, and again, I've been saying this for months and starting to repeat myself, that it makes sense to just do what we can to slow the spread of the new variants, just to buy us some time. I think the confounder here is in the messaging. We've been communicating this very, very poorly. I think there's a really good point made previously by Zane that we don't want to quell the optimism, but we can package this as heroism. Let's sit tight for just another month or so and save some lives, save the economy, and shorten our path to an open society that will never close again.
Okay, we're going to have to leave it there for tonight. Thank you so much, the Primetime panel, Laura and Zane and Raywat Deonandan joining us tonight. And thank you for tuning in to CBC's Power and Politics. I'm Catherine Cullen, sitting in for Vashi Kapelos. As we've been telling you, the big stories of the day, the presence of those variants of concern and how they are affecting case counts across the country. We're also talking about the effect of that Supreme Court case and ruling on carbon tax and how that is playing out across the country.